Gabelio Etch Time. The past, present, and future. Imagine waking up one morning with a sharp pain in your chest. Worried and anxious, you rush to the hospital, expecting to see doctors and nurses. But instead, the hospital is unlike anything you've ever seen before. There are no human doctors, no nurses checking your vitals. Instead, a digital screen asks you to place your finger on a scanner. In less than 10 seconds, an AI diagnoses your condition, assesses the severity, and instantly prescribes medication or even schedules you for surgery. But that's just the beginning. You are taken to the operating room where there are no human surgeons. Instead, robotic arms controlled by AI perform surgery with millimeter precision, without fatigue, without human error. Even the consulting doctors are no longer human. They are algorithms analyzing billions of medical records from around the world to determine the best possible treatment for you. Now, the big question: is this the future of medicine? Will human doctors become obsolete? And more importantly, are we truly ready to trust our health to machines? Artificial intelligence in medicine is not a new concept. In fact, its roots go back more than 60 years. In 1965, the first serious attempts to integrate AI into medicine began. One of the pioneering projects was Dendril, originally designed to analyze chemical compounds. However, these same techniques were soon applied to medical fields. A few years later, in the 1970s, mycin was developed. One of the first AI-based medical systems designed to diagnose infectious diseases and recommend antibiotic treatments. At the time, this was a groundbreaking achievement, but there were still many limitations. By the 1990s, advancements in machine learning algorithms brought significant changes. For the first time, AI systems could analyze complex patient data and assist doctors in diagnosing intricate diseases. However, the real breakthrough came in the 2010s and 2020s, when AI evolved from being just an assistive tool to actually outperforming human doctors in some areas. Today, deep learning algorithms can detect cancer in its earliest stages, analyze medical images with extreme precision, and even perform complex surgeries without human intervention. These advancements are astonishing, but one critical question remains. Will AI continue to serve as an assistant to human doctors, or will it eventually replace them entirely? Right now, AI is actively diagnosing diseases, recommending treatments, and even performing surgeries. Systems like ChatGPT in medicine analyze MRI scans, and surgical robots like Da Vinci have been used in thousands of procedures. But is AI just an assistant, or will it replace doctors? If AI completely replaces doctors, what will happen? Will patients trust robots? Who will be responsible for medical mistakes? Will this reduce healthcare costs or create new problems? Imagine it's 20 years into the future. Hospitals are fully digitized, and AI is no longer just an assistant, it is the primary doctor. You walk into a hospital, and instead of being greeted by a human, a robotic voice calmly asks you to stand in front of a scanner. In mere seconds, it scans your body, analyzing your health and displaying a complete diagnosis on a digital screen. No long waiting times, no need for human doctors to manually review your case. Everything happens instantly, but this is just the beginning. In many operating rooms, Complex surgeries that once required teams of highly skilled surgeons are now performed entirely by AI-driven robotic arms, no trembling hands, no fatigue, no emotions clouding judgment. Precision is at an all-time high, and medical costs have decreased. But does this mean human doctors are no longer needed? On one hand, this is a revolutionary leap forward. Many human errors, once caused by exhaustion or miscalculations, have been eliminated. AI doesn't let emotions interfere with medical decisions. But a critical question arises. Who is responsible? If an AI-powered surgeon makes a mistake, who is to blame? Can you sue a machine? But there's another side to this. The absence of human doctors means there's no one to offer real emotional support. No doctor who can truly empathize with a patient's suffering. Will people trust a cold, emotionless machine to take care of their health? Some see this as a utopian future, while others fear it. Are we heading toward a world where human doctors become obsolete? But are we truly heading toward a world where human doctors become obsolete? Is this an unavoidable future? Or could something unexpected change the course? Imagine a sudden global crisis, a massive cyber attack, a prolonged power outage, or a catastrophic failure in AI algorithms that shuts down hospitals worldwide. What happens then? With no human doctors left, the healthcare system collapses. Surgeries are cancelled, and even basic medical diagnoses become impossible. In that moment, would we wish that human doctors were still a part of our medical system? Now, the real question is, if everything becomes fully digital and AI takes complete control over healthcare, are we truly prepared for global disasters? This may sound like a scene from a sci-fi movie, but we have already seen glimpses of it in real life. Cyber attacks that have paralyzed hospital networks, power failures that have shut down critical life support systems, and even algorithmic mistakes that have endangered patients' lives. Now, imagine this happening on a global scale. Are we really ready? Perhaps it's time to ask ourselves, is complete reliance on AI in medicine a wise choice before it's too late? We've reached a point where AI in medicine is no longer just a tool, it's becoming a major force in diagnosis and treatment. But this raises some serious questions. If AI can diagnose diseases more accurately than human doctors, should we still trust human judgment? If a robotic surgeon could perform operations without making a single mistake, would you be willing to put your life in its hands? If an AI doctor told you that you had an incurable disease, would you accept its diagnosis? Or would you seek a second opinion from a human physician? What do you think? Will there ever come a day when human doctors no longer exist? Or will we always need them alongside AI? Let us know your thoughts in the comments. If you found this video interesting, make sure to hit the subscribe button and turn on the notifications so you never miss our future videos. What do you think about AI in medicine? Let us know in the comments below.